Hello, and thank you for joining me to attend the Women's Health and Wellness presentation. My name is Nourieh Belmouloud, a Master of Public Health student at the Gillens School of Global and Public Health at the University of North Carolina in Chapel Hill. I am an intern of the Office of Health Equity under the mentorship of Dr. Angelo Moore at Duke University Health System. To give you a short overview of the Office of Health Equity, it is Duke Cancer Institute's primary focal point for community outreach, particularly around hosting, coordinating, and participation in community health events and community-facing navigation. The mission of the Office of Health Equity is to reduce cancer disparities and promote health equity within Duke Cancer Institute's catchment area through community outreach and engagement, community-facing patient navigation services, health disparities education, clinical trials and education, and workplace diversity. Please feel free to contact the Office of Health Equity with any questions about conversations with our community events, patient navigation services, and any other questions you may have. A survey was sent out to the community to assess health needs, and most of the respondents said that they received the survey from the mosque or the masjid. And these are some of the results pertaining to women. So 33% of women who responded to the survey expressed that they did not have a mammogram to screen for breast cancer in the last year. 36% of women who took the survey said they did not have a pelvic exam to screen their reproductive organs for cancer during the past 3 years. 34% of women said they did not have a pap smear in the last 3 years to screen for cervical cancer. 21% of women surveyed said they did not have a colonoscopy to screen for colorectal cancer. 45% of survey respondents said they did not have a primary care physician. 56% of them said that they needed help to establish care. So this educational program was designed based on these survey results. And the objectives are to increase awareness about the importance of establishing primary care, encouraging adherence to regular health visits and health screening. So why are health screenings important? They're important to maintain good health, detect problems early when they are easier to treat, detect problems when there are no signs or symptoms, obtain information on how to stay healthy, reduce your risk of developing certain cancers like cervical cancer, reduce your risk of developing certain health conditions such as heart disease, avoid complications of chronic diseases like diabetes and hypertension. Why is it important to have routine exams and to keep your appointments for your physical exams? So regardless of age or stage of life, annual physical exams are essential to maintaining good health. Visiting your primary care doctor for regular preventive care is one of the best ways to identify and treat health issues before they get worse. You do not have to be sick to go to the doctor. In addition to establishing health goals and maintaining a relationship with your doctor, during your annual visit, you can assess your overall health, update your vaccinations, conduct any recommended screenings. So to assess your overall health, your provider will do a blood pressure check, which the guidelines say that normal blood pressure is 120/80 or lower. And a cholesterol screening, which measures the amount of fat in your blood. High cholesterol causes buildup in the arteries, which can lead to a heart attack. Blood glucose screening measures the amount of sugar in your blood to determine whether you're pre-diabetic, diabetic, or not diabetic. Osteoporosis screening is a test that measures how strong your bones are. And a BMI or body mass index, which measures if we are overweight, obese, or underweight. And being overweight causes health conditions that can lead to diabetes. This is just a chart that explains the normal range of blood sugars for non-diabetics, and then what are the ranges for pre-diabetics, and then the blood sugars for those who have diabetes. And this is from the CDC and the American Diabetes Association. Updating your vaccinations is also an important thing to do when you visit your doctor. So vaccines are not just for children. Adults need to keep their vaccines up to date to prevent serious diseases. Your doctor will review your vaccination history and risk factors during your annual physical exam and may recommend immunizations, which would include a Tdap vaccine, which is a combination that protects against tetanus, diphtheria, and pertussis. Adults should receive a booster dose of either Tdap or TD every 10 years. A TD is a different vaccine that protects against tetanus and diphtheria, but not pertussis. Flu shots are recommended each year for most people ages 6 months and older before or during the flu season to protect yourself, your family, and your community. HPV vaccine protects against cancers caused by human papillomavirus. It is strongly recommended for girls and boys ages 11 to 12. It can be given as early as 9 and up until 26. Adults can be vaccinated too if they did not receive the vaccine earlier on in life. More on updating your vaccinations. A pneumonia vaccine, if you have asthma or are a smoker or you're older than age 65, your doctor may recommend the pneumonia vaccine to prevent lung infections. Shingles vaccine is recommended for most adults ages 50 and older. And shingles is a very painful condition, so I would recommend getting that vaccine if you are in that age group. Hepatitis B vaccine, if you have diabetes or another condition that affects your immune system, work in the healthcare field, or live in a group environment such as a nursing home, your doctor may recommend the hepatitis B vaccine. This is a chart, a vaccination chart from the CDC that encompasses all the vaccines that are recommended by age group. So it would be a good idea to compare your vaccination record to this one and see if you need to update your vaccines accordingly. Screening for cancer is another benefit of going to the doctor regularly. So keeping up with routine cancer screening can increase your chances of detecting cancer in the earliest stages when it's most treatable. Your doctor will consider your age and risk factors during your annual physical exam and may recommend cancer screenings, including those for skin cancer, breast cancer, cervical cancer, colon cancer, or lung cancer. So what is cancer? Cancer is the uncontrolled growth of abnormal cells in the body. Cancer develops when the body's normal control mechanism stops working. So old cells do not die and instead grow out of control, forming new abnormal cells. These extra cells may form a mass of tissue called a tumor. Some cancers, such as leukemia, do not form tumors, but the cancer is in the blood. There's a link to an animated video about cancer that you can find in the comments section after this presentation. Cancer is the second most common cause of death in the US, exceeded only by heart disease, according to the American Cancer Society. What are the common cancers that affect women? The first one is breast cancer. About 1 in 8 US women, around 13%, will develop invasive breast cancer over the course of her lifetime. Breast cancer is a type of cancer that starts in the breast. Breast cancer cells usually form a tumor that can often be seen on X-ray or felt as a lump. Most breast lumps are benign and not cancerous. Breast cancer is a malignant tumor, which is a group of cancer cells that can grow. It starts in the cells of the breast and can metastasize or spread to surrounding tissues or take over distant areas of the body. This is just a picture of the anatomy of normal breast tissue. on the right-hand side, and then on the, on the left-hand side, and on the right-hand side, you have breasts with tumors and with inflammatory breast cancer. For more information, you can visit breastcancer.org. Cervical cancer. All women are at risk for cervical cancer. It occurs more in women over age 30. Long-lasting infection with certain types of human papillomavirus, or HPV, is the main cause of cervical cancer. HPV is a common virus that is passed from one person to another during intercourse. At least half of sexually active people will have HPV at some point in their lives, and a few women will get cervical cancer. This is another picture of some anatomy of the female reproductive organs, showing the cervix, which is circled in blue, and also showing cancer of the cervix in the picture in the bottom of the page. Colorectal cancer, although it is slightly more common in men, 1 in every 24 women will be diagnosed with colon or rectal cancer at some point in her life. Colorectal cancer, also known as colon cancer, rectal cancer, or bowel cancer, forms from uncontrolled cell growth in the colon or rectum, part of the large intestine. These growths are known as polyps. Because most people with colon polyps do not experience any symptoms, you might not know you have a polyp until your doctor finds it during an examination of your colon. So that is why screening is important. This is, on the left-hand side, you have a picture of a normal GI system and a healthy colon. And then you have colon cancer and polyps on the right-hand side. Lung cancer is the uncontrolled growth of abnormal cells in one or both lungs. These abnormal cells do not carry out the functions of normal lung cells and do not develop into healthy lung tissue. As they grow, abnormal cells can form tumors and interfere with the functioning of the lungs, which provide oxygen to the body through the blood. On the left-hand side, we have normal lung tissue. And on the right-hand side, you see the cancers in the lungs. So these are tumors, and this one here, and you have large cell carcinoma on this side as well. Healthy lifestyles. These are also items that were identified during the survey. So to stay healthy, we need to be eating healthy and staying active. So your food and physical activity each day affect your health. That's why it's very important to eat healthy and exercise. Eating healthier and exercising can help reduce your risk of developing these conditions, which are cancer, diabetes, heart disease, high blood pressure, high cholesterol, obesity, and stroke. Healthy eating. So we should all be eating fewer foods that have larger amounts of salt or sodium and sugar. And eat 5 servings of fruit and vegetables daily. Eat leaner cuts of meat and remove the skin from poultry. Instead of frying foods, try baking, broiling, and stewing foods. Regular physical activity is one of the most important things you can do for your health. Choosing moderate activities 3 times a week for 15 to 20 minutes is a great way to get started. Choose activities that are fun to you, that you can keep on, like walking briskly, Zumba, riding a bike, gardening. It's also good to have a buddy so you could be motivated and stay committed. These links are a resource within the American Cancer Society website, and they outline what screenings we should schedule based on our age group. They're available in English, Arabic, Chinese, and French. and they will be found in the comments section after this presentation. And these are screening and immunization resources to help you stay healthy. Durham County Department of Public Health provides immunizations, facilitates cervical and breast cancer screening. And Lincoln Community Health Center as well provides comprehensive primary and preventive health care, administers immunizations and cancer screenings. Duke Primary Care provides comprehensive primary and preventive health services, administers immunizations, provides cancer screening, and can help you keep up with your health issues if you have any. Duke Office of Health Equity can assist with obtaining a primary care provider to get immunizations and cancer screenings. It also provides education on recommended cancer screenings. If you need assistance, please feel free to contact the Office of Health Equity, and that's if you need assistance to establish care, if you need to make an appointment, if you need any screening services, if you need educational materials about any of the health topics discussed in this video or other topics. And these are the contact information for the Office of Health Equity. So what we ask of you is to take action to establish care with primary care provider or doctor or nurse. Schedule your physical exam, check your immunization record and make sure you're up to date. Schedule your cancer screening tests if you are due for any. Make lifestyle changes and establish a plan to maintain your progress. After all, healthy people means healthy communities, which means healthy populations. We would like to receive your feedback, so please click on the link in the comments section to fill out a short survey. And thank you so much for attending this presentation.